Hi friends, welcome to Classes by Lab Doctor. In today's class, let us discuss about warfarin. So we have studied in our previous classes about various anticoagulants, heparin. Today, another very commonly used anticoagulant or a blood thinner, that is warfarin. We will study about its mechanism of action, its uses, its side effects, precautions, drug interactions. Okay, so warfarin also is a blood thinner. It's an anticoagulant. It prevents the coagulation of blood. So when it prevents the coagulation, it prevents the formation of clots. So it makes the blood thin. Okay, so that is why we call it as anticoagulant or blood thinner. Okay, so whenever there are blood clots or risk of developing blood clots, okay, like patient is having varicose veins, he is having a risk of developing thrombus in his veins. To prevent that thrombus, doctor puts them on these anticoagulants to prevent these clots from becoming big, or to prevent these clots from getting dislodged from the leg veins and go to the lung veins, we give them anticoagulants. Patient is having atrial fibrillation, his heart is fluttering, so in the flutter it might dislodge a clot. So in such patients who are at risk, patient has developed a stroke, there is a clot which has prevented the blood supply going to that brain, and there is a chance that that patient might develop complete cut off of the blood supply, or he might develop another clot. In such patients, to prevent complications, to prevent the development of this paralysis or stroke, we put them on anticoagulants. Okay, so warfarin, thus it's a very commonly used anticoagulant, and it helps the clinician to prevent the risks and complication of this clot formation. So this is what I was telling you, that prevention of certain disorders. So this is the limb vein. Here you can see there is a thrombi. There is a chance that this thrombi from this vein can go and enter your pulmonary circulation, and there can be formation of a pulmonary embolism. So to prevent pulmonary embolism, in deep vein thrombosis we put it. In atrial fibrillation, this clot here can get dislodged and go and block a blood vessel of the brain, causing stroke. Okay, so to prevent such complications, we used warfarin. So now how does warfarin work? So I've told you warfarin is an anticoagulant. It prevents the coagulation. So now how it prevents coagulation? It will prevent the action of vitamin K. It is a vitamin K antagonist. Okay. So why do we need vitamin K? Vitamin K is required because there are certain coagulation factors like 2, 7, 9, 10, which are all vitamin dependent. So if your vitamin K dependent factors are blocked, your coagulation is not going to take place. So if coagulation is not going to take place, there is no formation of a clot, isn't it? So that is why we use warfarin as an anticoagulant. So warfarin mainly acts by blocking the action of vitamin K. This warfarin, it will block the enzyme epoxide reductase complex. Okay, so this is going to block this vitamin K epoxide. This is very essential vitamin K, because I've told you the several factors 2, 7, 9, 10, protein C, protein S, all these are dependent on this vitamin K. So warfarin, it will block this enzyme and it will see that precursor prothrombin is not converted into biologically active prothrombin. Okay, so this vitamin K epoxide reductase, when it is blocked by this warfarin, this entire process is compromised and the precursor prothrombin is there. Inactive prothrombin is not converted to prothrombin and the process of coagulation is halted. Hence, it acts as an anticoagulant. This I've told you, the warfarin, it is used in this DVT, pulmonary embolism, arrhythmia, stroke, okay, atrial fibrillation, myocardial infarction, congestive heart failure, etc. So these are all the uses of this warfarin. You usually will see that patients who are having DVT or PE or stroke or irregular heartbeats or mechanical heart valves or heart attacks, to prevent recurrence of this myocardial infarction, transient ischemic attack. If the patient has once developed this, there is risk that he might next time develop a stroke. To prevent all these, we put such patients on warfarin. Warfarin comes with certain side effects and risks, definitely, because it prevents coagulation. So if the dose or the duration of it is not monitored properly, then patients will have certain side effects. That is, one is bleeding gums or nose bleeds. So he can have unexplained bleeding. He can have sudden headache if there is an intracranial bleed. There can be dizziness when there is an intracranial bleed. Sometimes patient might find difficulty in breathing. Patients might have bleeding from the wounds, cuts, injection sites, which is very much unexplained in a normal person. Sometimes when the patient is on warfarin, patients will have unexplained bleeding from these wounds, cuts or injection sites because it is thinning your blood. Patients might complain of heavy menstrual periods or abnormal vaginal bleeding sometimes. Sometimes patient also complains about blood in the urine because there might be bleeding in the genitourinary tract. So there might be blood in the urine. There might be bleeding in the gastrointestinal tract. Hence the blood might be passed in the stools and the patient might have black or tarry stools. Sometimes when the patient bleeds inside the GI tract, patient might vomit. There is a coffee ground vomitus. Sometimes even patient develop rashes to this warfarin, allergic rashes. Hair loss is also possible, as we have discussed with your heparin. It might be interfering with the growth phase of this hair, the warfarin, and hence causing hair loss. There might be sudden change in the speech or vision if there is a intracranial bleed, or if there is an bleed in the eye. Then there might be vision disturbances. In the bleed in the brain, the patient's speech may be altered. Numbness or tingling on one side of the face or of the arm, that can happen. Something called as the purple toe syndrome, that can also occur because there will be blockage in the small blood vessels of the foot, leading to this complications. So these are few of the side effects of warfarin. And also note that warfarin has to be taken with precaution, because and it also has to be monitored regularly. It comes with a black box warning that the INR, PT INR has to be monitored regularly when we are taking this warfarin. Okay, because warfarin is unsuitable for people who are allergic to this drug, or it might cause symptoms like trouble in breathing or swelling of the tongue, throat swelling, etc. So people who are allergic to warfarin, they should avoid this. If you are going for a surgery or a dental treatment and you are on warfarin, there is a risk of increased bleeding. So it is always better that you should tell your doctors that you are on warfarin, and before going to any of such procedures, your dental procedure or any kind of a surgery, you should discuss with the doctor and adjust your dosage or change your dosage as per your doctor's advice. If you are having high blood pressure, there is increased risk of bleeding, because one is the pressure of the blood inside the vessels, and secondly warfarin by itself is not allowing the blood to clot, so there might be increased risk of bleeding. So patients who are having high blood pressure, they also should be cautious. Alcohol, so large amount of alcohol should be avoided when you are on warfarin therapy because it can cause increased bleed. Why? Because alcoholism or alcohol can interfere with the warfarin's metabolism, with different effects happening when you are consuming either acute alcohol or chronic alcoholics. They have different effects depending upon how long they have been taking this alcohol. But yes, alcohol definitely has interaction with this warfarin, and it affects its clearing, and hence it can affect your risk of bleeding. So if you are consuming alcohol and you are also on warfarin, you should be cautious. You need to discuss this with your doctor. If you already have a bleeding disorder, the use of warfarin is contraindicated in such patients who are having active bleeding or a hemorrhagic diathesis, because there is increased risk that when you give such patient this warfarin, it will increase the chance of uncontrollable hemorrhage or bleeding complication. Warfarin is contraindicated in patients with previous history of intracranial hemorrhage or recent history of an extracranial bleeding. Okay, it's because it will again increase the risk of bleeding, and intracranial bleed has its own complication. It can cause severe complications, and it can cause permanent scarring and damage. Hence it has to be avoided in patients who are having this head trauma. So warfarin is not recommended during pregnancy because it causes congenital disabilities and bleeding problems for the baby also. And warfarin passes into the breast milk in small amounts. So usually we do not suggest or recommend warfarin during breastfeeding as well as in pregnancy. If the patient is having kidney disease, chronic kidney disease, etc., it might interfere with its clearance. Hence it may not be very suitable for them, and even if we have to give, we have to monitor it thoroughly. Patient is having an active ulcer, is having a peptic ulcer, etc., and we give them warfarin, it increases the risk of bleeding. So active bleeding anywhere, maybe in the GIT also, we should avoid this medicine. Older adults are more sensitive to warfarin due to, one is their low body weight, reduced liver, kidney function, and they take less of vitamin K also. So, them also we have to be little more vigilant when we are giving warfarin. If you are on warfarin, you should be little cautious when you are, brushing or shaving, etc., because there might be a risk of bleeding. So when you are warfarin or when you are on warfarin, you should be cautious about these conditions. So these were a few tips about precautions or the side effects or the mechanism of actions of warfarin. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.